evening. My name is Dr. Parth Goyal and I am a consultant psychiatrist at Parth Hospital, Ahmedabad. In continuation with our video series, today I would like to talk to you about specifically the symptoms of a manic state. Mania is a state of illness which is seen in patients with bipolar mood disorder. As I've talked in my previous video, patients with bipolar mood disorder alternate between a manic state and a depressive state. This video will give you information about the symptoms that a patient who is experiencing mania exhibits. The most important aspect of a manic disorder is the presence of either a euphoric or an irritable mood. Euphoric mood means the patient is happy for no reason and the happiness knows no bounds. Most patients are happy because their euphoria is stemming from the fact that they have a delusion of grandiosity. For example, that they think that they are incarnations of gods, they have godly powers, they are immensely wealthy, they are immensely rich, they have a lot of control over things, they are connected to very powerful people, they are themselves very powerful people. This thought process leads to an intense state of happiness. Sometimes, along with the euphoric mood, they can also exhibit an irritable mood where they might be very aggressive or they might be very irritable on small matters. Irritability can be seen either in the form of argumentativeness, where they can engage in repeated arguments, or in the form of shouting, screaming, yelling, or sometimes even physical violence. Along with that, patients who are experiencing a manic phase experience a very high number of thoughts. The rate at which the thoughts happen in their minds or brain is very high. The rate is so high that before the first thought gets completed, the second thought comes in. This is also reflected in their speech, where they speak very fast, and once they start talking, they go from one topic to another, from the second to the third, from the third to the fourth. By the end of it, we don't know where they started from and where they have ended. This also manifests in the form of energy. Patients who are experiencing a manic phase have a lot of physical energy. This reduces the requirement of sleep. They sleep less at night and they are engaged in meaningless activities. What this means is that they have a lot of energy, they do a lot of work, but every task that they do is incomplete because their mind is continuously shifting from one topic to another, to another, to another. Along with this, some patients of manic disorder or some patients who are experiencing a manic phase, because of the grandiosity, might indulge in excessive risk-taking behavior. For example, driving rashly, making unsubstantiated investments of value that they cannot honor. For example, patients can go and buy multiple cars, they can buy multiple plots of land, they can make very risky investments in the stock market. They can also indulge in excessive spending because in their delusional world they have a lot of money. So you can have patients, we have patients who are very poor but end up spending 2,000, 3,000, 5,000 rupees a day, which is well above their ability to earn. They can also indulge in risky habits, for example, excessive sexual indulgence, where they can, because of the symptom of hypersexuality, they can have sex with multiple people. These are just, in short, a brief overview of the symptoms that a patient who is experiencing a manic phase can present with. I have tried to cover most symptoms. However, there are some other symptoms, for example, paranoia or other psychotic features which can coexist along with symptoms of manic state. I hope you have found this video helpful in understanding what a manic disorder is. For more information, please log on to our website www.parthhospital.com. Please like and subscribe. Thank you.